Hello, pharmacists and friends. Today is Monday, March 4th, 2024. Welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen in to find out how we can all improve population health, health equity, and patient care through advocacy and education. My name is Tony Sulo. I'm a sixth and final year Doctor of Pharmacy student at the University of Rhode Island, working alongside Dr. Bratberg and the Rhode Island Department of Health.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research here at the URI College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by the hosts and guests do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
Today, we're honored to be joined by Dr. Ann Hume, a professor here at URI and our special guest of the day. Her teaching and scholarship includes primary care, geriatrics, interprofessional education and practice, and integrative medicine. She's been published extensively, is a reviewer for primary care, nursing, and pharmacy journals, and is an associate editor of the American Pharmacists Association of Non-Prescription Drug Therapy. Her research areas include interprofessional education and practice, geriatric pharmacotherapy, applying evidence-based guidelines in primary care, and integrative medicine. Dr. Hume, we're happy to have you here today.
Thank you so much for the invitation.
So what is integrative medicine and how do you use it in your practice?
Probably the best description would be the use of those health practices that at least traditionally were not considered part of Western medicine. And for example, a patient who uses acupuncture or massage therapy. As far as how I use it in my practice, well, I'm not really certain I have a practice anymore. I will tell you, I have recommended acupuncture for chronic low back pain actually for a long time. As you know, many of the analgesics, especially opiates, that we use for chronic low back pain, while initially they may have some benefit, long-term, it's how many people start into addiction to the drugs.
And Dr. Bratberg, have you used integrative medicine in your practice before?
I would say that I have a complicated relationship with integrative medicine, and that I think that as it was maybe previously called and probably a little different as alternative medicine, and if it's alternative medicine, I used to always say that it's not medicine then, right? But as an evidence-based practitioner, I think I've heard a lot of things, a lot of the books that Paul Offit, who's a vaccine researcher and leader and pediatrician in Philadelphia, wrote a book called Do You Believe in Magic, which was all about supplements and the $12 billion supplement industry. And so teaching a class that Tony took and I'm teaching tonight called Communicating Vaccines, there's always a lot of talk about people with vaccine hesitancy, believing in supplements and things. In my other realm of research studying opioid use disorder, there's also lots of things like ayahuasca and kratom and things like that that are going on, and currently legislation in terms of kratom that Tony and I are going to explore here. So I think that, you know, if there's evidence, I think it's great. I mean, people close to me say, should I use glucosamine for my joints? I'm sort of like, well, I don't know, what would you say, Anne?
Well, as a disclaimer, I actually do use glucosamine,
Oh, there you go.
as well as my Scottish Terriers, and the three of us swear by it. But I use as an outcome measure, do I use less ibuprofen?
Right.
Now, in all honesty, I have to admit, I know very well if I lost 30 pounds, that probably would do more for my knees than glucosamine. And Jeff, if I can interject,
Please.
You mentioned kratom.
Yeah.
I was in the family care center a few years ago, and one of the medical residents came down the hallway and he asked me, he said his patient had got kratom. So I told him a little bit what I knew about it. So as I was talking, I asked, well, where did your patient buy this? He had actually ordered it from Indonesia, but he had bought 17 pounds of kratom. And it's like, first of all, I wasn't really certain it was legal to import that. But, you know, it always comes down to, and when I've worked with young medical residents, the important thing is to be asking your patients what they're taking.
Yeah, I think we're actually teaching the P1s in new course, teaching that course is to say, and even on P4s when I did when I did internal medicine rotations is like, or even in infectious diseases, what are all the things you're taking? So people say, well, I'm taking this, this, and this. And again, and even in taking care of people who use drugs, a highly stigmatized thing. It's until you build that trust. Obviously, things like using fentanyl or methamphetamine are more stigmatized than using kratom, but we've got to build that, or cannabis or things like that. So I think you've got to build that. Oh, I mean, my first month, I think my first week in the ICU as a resident, somebody brought this big box, and I'm mimicking this box. It's an audio format, but this big box, and they're like, here are 80 supplements. You pharmacy resident, figure out what this is. This person's in a coma. What thing caused the coma? And you're like, you've got to be kidding me. But I learned a lot about it. Actually, in my second residency, I guess I've done a lot of integrated medicine. My residency project was surveying our HIV patients, and this is before a lot of the therapies we had. This is 2002. Mm-hmm. And what are they using? Why are they using it? I never published or presented it, Anne, so I know I failed there. But you did hire me, so I guess my residency project wasn't the tipping point.
There is a journal for every manuscript.
Yeah, so, and I think my other thing that we've taught the students over and over again is cranberry for UTI. And over the years, as I've taught that, some people say they swear by it, some people say that they don't like it, people have personal experience. It's always like, is this harmful or is this not? I actually did, Maggie Charpentier, colleague Dr. Charpentier, did a thing called Live Strong, and I used to work at the YMCA in my town. I actually brought my P4s, and we talked to folks who were living with or in recovery from cancer, and we said, what are the things to do? And people would say they had this thing called alkaline water. Have you heard, Tony, what that is?
Heard of that.
I don't know what it's for or what it's good for, but the idea is to be like, it's motivational interviewing to say, okay, you take these things. Does it make you feel better? Do you also take your tamoxifen? Okay, that's my thing. It's like, how do you counsel patients or teach folks, Anne, about the idea of, integrative medicine implies that you're also taking so-called Western medicine. How do you counsel people to sort of take a full history and not judge one segment over the other?
Well, it goes back to what you mentioned as far as building trust. I'm very old as a pharmacist. There have been many drugs that we swore by in practice as being effective. Propoxyphene or Darvon was this magical drug. And lo and behold, it did nothing but, get people addicted. So I think it's always being, trying to form that relationship. Also being honest. I'm continually learning about supplements. Things that I thought I knew a lot about as I did more research. So being open, being honest if you don't know, what the patient's talking about, but being very non-judgmental as to what they're doing. And over time, I think most people are very open to learning, but they've got to trust you and you have to be respectful.
Yeah, it's a great transition to Tony's next segment here.
So obviously a lot of our discussion is going to be about dietary supplements. I did kind of want to just put like a little disclaimer out there and address some of the misconceptions that we've kind of already touched on. Many people believe that the FDA regulates the safety and efficacy of supplements prior to their marketing, which we know that this isn't exactly true. According to the 2019 American Association of Retired Persons, or AARP, Brain Health and Dietary Supplement Survey, 49% of adults believed this to be true of vitamins and minerals. And a lot of people think that there's little to no risk of using dietary supplements at all. What are some possible risks associated with dietary supplements?
I was thinking about this. I think number one risk is no efficacy. You've spent a significant amount of money on some of these supplements. Prevagen, for example, which comes in 3 different strengths. I think one is like $45, $55, and $60 a month. So a lack of efficacy. And in reality, if whatever supplement somebody's using actually works, for example, weight loss, erectile dysfunction, more likely than not, it actually contains a prescription drug like sibutramine or sildenafil. So that would be number one. I think just in general, and the addition of those drugs is an example of adulteration. I do want to mention the U.S. dietary supplement industry and many of the companies globally, they are, I think, in general, very reputable companies. If you go into any major retailer, whether it's Whole Foods, CVS, whatever, the likelihood that you're going to encounter an adulterated supplement, I think it's actually pretty low. Where patients get into problems is when they're seeing things on TikTok, Instagram, and they're buying things over the internet. And just to give a couple of examples, at my site in Pawtucket, I'll always remember, and this is like 5 or 6 years ago, we had a woman, late 20s, early 30s, who, after she had given birth, and I think it was 6 months postpartum, she hadn't lost the weight that she had hoped to have. So she bought these pills, the Brazilian weight loss formula, and come to find out, did contain several amphetamines. But she went on to have a stroke. She did recover, at least to, not dying. But products like that, I think, are very important and kind of related. And I know I'm starting to go on tangent. The other thing, in using some of these formulations bought over the internet, the New England Journal of Medicine about 10 years ago had this really interesting little case report. This police officer, I think somewhere in the Midwest, a very solid citizen, had been told by higher administration that he needed to lose weight. So, of course, he went ahead and bought one of these internet weight loss formulas. And when he happened to get tested, and he was losing weight, but when he got tested as part of his routine employment, tested positive for amphetamines and was subsequently fired. So I would say lack of efficacy, adulteration, and if I can give one other example of adulteration, since it's kind of also in this weight loss. We had an episode in Rhode Island maybe 10, 15 years ago of these otherwise healthy young women in their early 20s who had gone to, I don't think it was an acupuncturist, but some type of truly alternative medicine spa, and was given these Chinese slimming formulas.
Oh boy.
And what it actually came to contain is like uricolic acid, which is a very potent nephrotoxin.
Yeah.
So what we saw in Providence, and it was also observed throughout the country, are these little micro epidemics of 7 to 8 young, healthy women who were presenting to the emergency department with what looked like end-stage kidney failure. Fortunately, some of them recovered, and the others were fortunate enough to get kidney transplants. So, to kind of summarize, I think the vast majority of supplements that are available, they are safe. Whether they're effective is something different, and that's not a requirement of the FDA. The FDA really has 2 standards under DSHEA. It has to be safe, and safety reporting is at the discretion of the manufacturer. And what's on the label has to abide with what's under DSHEA. But just recognizing the typical supplements, I think, are fairly safe. But adulteration, and I should mention, if I can use one
Go
more
ahead.
example, especially on the topic of weight loss supplements, maybe about 5-7 years ago, there was a supplement called Hoodia that was really in vogue, and it was supposed to be based on a plant that the indigenous people of sub-Saharan Africa that lived on nothing were chewing. It helped stimulate and control their appetite. Well, of course, Americans want to take a supplement. They don't want to go to the gym or do anything hard like that, were buying Hoodia like crazy. Well, the problem is Americans had bought more Hoodia supplements than the plant had ever existed on the face of the earth. So, and that's actually called economic adulteration. But yeah. Oh, one other thing.
Yeah, go ahead.
I swear, last thing. So when I think it was last week, in doing a little bit more research on brain health supplements, and it was in JAMA actually. Apparently, you can buy galantamine, which is an acetylcholinesterase inhibitor, without a prescription. It's a dietary supplement, and it's listed. It is from a plant. I think some of the plants in the daffodil family make a compound just like galantamine, which old-timey, not real effective drug that we've used for dementia. But apparently it is being marketed, and I did find it on the internet. It tends to be a very expensive dietary supplement, but it's like, my God. Anyways, sorry.
So the lesson is don't go on the internet to buy things.
Right, as people are listening to this.
Yeah.
Right, don't go
Well, it's interesting. I think we were at, or maybe it was my previous student, talking about fake Ozempic, right? So the GLP-1s and compounders and the right salt and things, and that they can call it Ozempic. And yeah, I mean, so even things that have that, it's interesting when you're talking about safety. I remember I actually published a case report with a student now 7 years ago on Garcinia cambogia. We had a patient in the ICU in DKA, diabetic ketoacidosis, a very severe condition, and pancreatitis. And so as you talk about, supplements that cause kidney failure, I've seen liver failure. This was, pancreatitis. And we traced it back to a theoretical thing, and we published it in the Rhode Island Medical Journal. So it's very interesting. So I think you've answered a little bit about how many people. My next question is really on efficacy, but so how many people think supplements work? And you talked a little bit earlier about people's desired outcomes, weight loss, and if you're having an outcome, it's probably adulterated with something, and if you bought it on the internet, it's probably adulterated with something. So how do we? Maybe the better question is, how do we get people to sort of question supplements? Because again, it's the easy thing. You don't have to talk to a doctor. You can buy it on the internet. It's private. It's anonymous. Like, how do we address that?
In thinking about it, there are many parallels between people's interest in supplements and some of the myths about vaccines.
Mm-hmm.
They want an easier way. They question big pharma, trying to push prescription drugs. And I think, again, many people have lost trust in science, partly through the pandemic, but undercurrents of it have always been present. I mean, the first work, at least in this country, first published work on the widespread use of dietary supplements, I think was in 1990. So we're well into 30 years, but it's become much more pronounced. I don't know if we're allowed to name people. Mike, the My Pillow guy.
Oh, yeah.
Pushing oleander. Oh my God! It's like
Anna's reacting non-verbal ways.
It's like that.
Isn't that highly
painting
toxic?
Of the Scream. It's like, oh, please.
Yes, Edvard Munch. Yeah.
Yeah.
What maybe you should tell people what oleander does. There's like white oleander and
I think yellow oleander, but
it's dig toxic. I actually put that in my lecture in this fall. Yeah. It's like digoxin.
Hepatotoxic, nephrotoxic, but if I can tell you a story about my nephew, a little anecdote. My nephew is actually a grown man now, grown-ass man. When he was a teenager, athlete in high school, football, basketball, all around, and to see him, very muscle. Really big guy. It would be easy to think, he's using steroids or something like that. And one of the times he went to the emergency department, he subsequently has had some major health issues, not related. to steroids. But all the physicians he encountered kept asking him about anabolic steroids and supplements, and his famous line that I always think, and he would no more ever have done that, but my body is my temple. Why would I pollute my temple with supplements and all this stuff?
I like that.
But just, people, and I think to a large degree, it's anti-science. And we are surrounded by pharmaceutical advertising, and I think there is just such a sense of distrust. I mean, during the beginning part of the pandemic, and again, I'm old, but when I
So
think
which pandemic are you talking about?
Yeah, the pandemic of 1920. Yeah, flu started in Kansas, something like that. But, I always go back to, it's just very disheartening when I would read about the threats that Anthony Fauci, his family were receiving, that he needed bodyguards. People were so angry and felt this was all a conspiracy. And I think much of this has just continued to be fueled. Now, that's one side. There are a group of people, you can edit this out, crazy nutballs. I mean, just off the, am I allowed to swear?
Yeah, sure. Yeah.
Fucking lunatics. Some of these deep state fringe. So that's one big group. And that has certainly ballooned since the pandemic.
Well, it's self-generating too, because I talk about this with my students, where you believe that you believe these things don't work, you're anti-science, and then the anti-science people go, hey, we've got this easy thing, supplements or anti-vax, or just be pure, or do silver colloidal enemas like to get rid of vaccine. I mean, it's just so it just becomes this self-generating prophecy. But they're always saying, like, the more that science tries to push and persuade, the more that they're pushed away. And so it becomes this tribalism to say, well, I'm just going to ignore everything you say because you were wrong, because somebody told me you were wrong. And yeah, it's difficult.
So there's that group, and unfortunately has expanded significantly. But there always have been other Americans who really are very interested in natural approaches, and they're fundamentally, I think, a very different group of people. Their beliefs they've always had. It's not, this is the latest deep state issue.
It's interesting. I was at a restaurant this weekend, and I was just ordering a sandwich, and I saw on the TV, they're like, I just heard out of my head and said, so you're telling me that the anti-inflammatories today use the COX-2 pathway? And I'm like, what is going on like a Saturday at noon here? And then they're like, yeah, well, we've got this formula of 3 different natural. They're like, the COX-2 pathway is not natural. And I'm like, my poor partner is like, I'm like, oh God, I got to watch this supplement. I got to do this podcast Monday. And they said, there's tamarind and turmeric, and they had this nice little graph where it's like COX-2 doesn't work, and hitting all the different pathways. I'm going, so it's so hilarious that people are anti-science, yet they use sciencey terms, and it's very persuasive. So when I teach people to convince people to get vaccines, it's sort of about like what's the outcome and those types of things. But always a group that we're never going to get. But I agree, there's definitely a persuadable middle to say, you're interested in your health, let's try to do that sort of thing.
Yeah, I think also too, like, more to this point is a lot of the conversations that I have with like these patients that approach the pharmacy counter is it always starts the same way as like, oh, well, I don't want to take a prescription med because I want a more natural approach. And then I kind of lay it on them and have the conversation like, you don't know that supplement is natural. You have no idea where that came from. You have no idea what's in it. So if you want to take a natural approach, if you want to take a turmeric supplement, like, why don't you just buy organic turmeric, like, and eat that and put it on your food, as opposed to taking the supplement, which you have no idea what's in it. We have no idea where it came from. You have no idea who makes it. And it's probably 3 times the price as you buying the actual spice from the grocery store. So.
And Tony, I think you've brought up a really great point. One thing when people express the interest, they want something natural. Um, I have had this used as a segue into, instead of taking the supplement, let's talk about your diet and ways that you can intervene in that area. And occasionally it's worked, that people are interested in trying that instead of simply taking a supplement.
Yeah, and a lot of my success stories are similar to that in the sense that, like, as you mentioned before, the idea of like Eastern medicine and traditional Chinese medicine is a lot of based on food as medicine as opposed to just taking a supplement. And that's kind of been like my personal area of study over the last year or so recently, and kind of what I hope to pursue. But I try to like involve that in my conversations and my motivational interviewing with patients to try to get them to expand their view of what is natural and what could be beneficial, and maybe we should start looking at your dietary intake and ways that we could change that.
Well, I mean, it's like the diet, it's like the idea of processed food versus non-processed food. But again, as Anne said, it's really, really hard to change people's diet. They're many years in, it's influenced by culture, all these kinds of things. When I taught a colloquium class, and we had the students track what they eat and track what they sleep and track their exercise, and they're like, they were horrified, these 20-year-olds, these sophomores going, and one student would say, it was so hard to realize that in my culture, like rice and beans and beef are like such a huge part of this, but now you're saying it's more healthy to not eat red meat, which I know, but doing it is a thing, where a supplement is, you don't have to cook it. You're told that you're not getting these things. There's certain elements you're not getting, but maybe integrative medicine incorporates all those types of things.
And you brought up some kind of powerful stories before about supplements having unapproved drugs in them or unauthorized things that shouldn't have been in there. There was one story that I found in the Neurology Clinical Practice Journal that was published in 2020. And they looked at 8 different brands of brain health supplements, and they found unapproved drug in it. So the drug piracetam, which is not approved in the U.S. but can be used in other countries, mainly some European countries, for epilepsy, was found in these brain health supplements. And what I found most interesting is that these products actually listed on the label that piracetam was in it, kind of preying on the fact that the general public will have no idea that that's an actual drug somewhere else and not just some natural, so-called natural thing. So what do you think should be done to better protect the public from exposure to these kind of stories like the ones you brought up before and this one?
I'm trying not to give a smart-ass response.
You can.
It's just really important that the FDA works under what's called Dietary, the Dietary Supplement and Health Education Act, which it's really interesting to learn the background of that law. When Dietary was enacted, I want to say late 1980s, early 1990s, the 3 senior senators, Tom Harkin from Arkansas, Jesse Helms from North Carolina, and I'm blanking, Senator Orrin Hatch from Utah. Those 3 states are the home of the U.S. dietary supplement industry. So 3 very senior ranking members of the Senate, when this law was initially going to be proposed, they made it very clear to their colleagues that had no chance in hell of passing the original legislation that had wanted to be passed, because these products, according to the industry, had always been around. They were natural, they were safe, and you were intervening on a person's right to try these. So as a result, that's why Dietary is the way it is. Now, there have been subsequently a couple of other laws that have placed more of an emphasis on reporting adverse effects. But to answer your question, I think most importantly, better enforcement by the FDA. Right. And again, FDA is underfunded. It's never going to be appropriately funded. But having more inspections, especially of the U.S. natural product industry. But as I've already said, I think the biggest problems are from companies who are marketing products over the internet that aren't going to be selling at GNC or Whole Foods. I think that's probably the most important one. And continuing to give consumers the message, there are ways that you can identify, is this a quality supplement? Consumer Labs puts little symbols on products they've tested. NSF and USP also do. So look for a product that, more likely than not, if you're in BJ's or Costco, you're not in buying your supplements there, or CVS or any major retailer. More likely than not, those are going to be, at least they won't kill you. More likely than not, if that's a positive at all. They're not going to be contaminated with lead, with manganese, with potentially deadly plants.
Yeah, enforcement's definitely it, but I'm sure, it's as I mentioned earlier, it's a, double-digit billion-dollar industry. Like I said, you turn on TV, you look on the internet, it is just a rabid marketing. And again, they know their audience. Again, they know the anti-science audience. It is growing. I mean, would you say that the industry continues to grow, again, based on...
Definitely. Yeah. And in some respects, the dietary supplement or the products that get marketed, especially for brain health, it's a little bit like whack-a-mole. And a couple of years ago, I had 2 students do a project where we looked at what was being marketed online by major retailers, also through Amazon. I think it was like 18 months difference in the time points when we were looking. Products were different, the product names were different, kind of similar ingredients. But for the typical, family member, caregiver that might be looking, they're going to have no idea that, the products have no efficacy. They make many claims, but just very different, and they're always going to be developing new products, but it's the same old ingredients.
Keep listening to hear Ann Hume discuss Prevagen and offer her advice for preserving brain health. I think one of the most well-known brain health supplements, because of its marketing, is Prevagen. So, like I said, it's well known for its advertising. They boast this unique ingredient that comes from jellyfish, and they actually had studies to try to back it up by the people that make it, called Quincy Bioscience.
One study.
And so it was a randomized control trial, and their hope was to substantiate the health claim that Prevagen can prevent decline in cognitive function. It was called the Madison Memory Study, and there was a lot of scrutiny for it being misleading. And what's your take on this trial and Prevagen?
I'm an academic. When I see an abstract being presented at a national meeting in 2008, 2009, and it doesn't get published until 2016, something's wrong, including, I think, and I'm not making fun, although it'll sound like I am. I think it was published in Advances in Mind, Body Health. That's not a journal that I routinely read.
Do you have to pay to publish in it too?
I don't know. Okay. I don't know. But anyways, just a quick synopsis of that study. So I think there were a little over 200 people 40 to 90, big age range, and they had self-reported memory problems, which many people do. Usually it's just the result of stress or depression. And they did use this computer-based testing, which is kind of like WTF, but I've since, sorry, you can edit that out.
No, we're keeping that in.
Yeah, that's staying.
When I first looked at it, one of the tests was the International Shopping List Inventory. But in my ignorance, I have since learned that, this battery of computer-based testing is used in research studies of cognition, but very different than what we would use clinically, like the MoCA or the MMSE. And so that's okay. And what the study showed, and I think it was actually open label, wasn't really randomized. They might have said it was randomized. I don't think it really was. But they had like 129 and maybe 70 people in the placebo. But what they identified in the early ads with Prevagen, and again, my husband and I are old, so we watch the evening national news, and it's nothing but Prevagen ads. The ads have really changed. The first Prevagen ad, it was clearly more getting to the point of disease-related claim. And Prevagen can only carry a structure-function claim. Now, it's morphed over time, so they are more careful with what they're stating. But, the ads, and there basically are three types of ads with Prevagen. One is the classic jellyfish, and it's showing that. And
jellyfish don't forget.
Yeah, jellyfish don't forget, like sharks don't get cancer. So the jellyfish is in the background, just beautiful visual. And then there's this graph of placebo versus Prevagen and showing that memory is improved. Now, it's only verbal learning. For many of the outcome measures they tested, there wasn't any difference. But I'm always amused. So they tested at baseline, I think at 30 days, 60 days, and 90. They only show the date. They don't show the 60-day data where the placebo people actually did better than the Prevagen people.
Funny how they missed that.
I do want to talk about the other types of Prevagen ads, but before I do that, I'm very simplistic in my thinking. I did not do well in med chem in my degree at the University of Pittsburgh. I barely passed. I needed C-, and I cried my way to a C- in a faculty member's office when I promised him I would not go into med chem or pharmacology. But Prevagen's a protein from jellyfish. Okay. We've got acid in our stomachs. Yeah, it's kind of like, why don't we have oral insulin? Well, it's a protein, and when you take a protein, the acid dissolves it, and you're supposed to break it down into amino acids, and the amino acids get absorbed, and who knows what happens after that. Okay, so let's even say Prevagen maybe 10, 20% actually does get absorbed intact, which actually does not make any sense. The next thing that kind of has stumped me, how does it cross the blood-brain barrier? And how does it know that it's got to go into the hippocampus? There are at least, and again, I know very little about neurology, but how does it know to go to those 2 or 3 centers in the brain where memories are formed? I like magic as much as the next person, but wishing it doesn't make it true. And I always like to say, I would love to be 5'10" with my current body weight, just never going to happen. So wishing it, it's again kind of magical thinking. So I talked about the classic jellyfish ad. There are 2 others that, whenever I look at these ads, I can feel.
Do you see all through? Do they rotate through them on the evening news?
It's pretty random whether it's going to be a jellyfish week. But there are 2 other types of ads that it's like, and again, excuse me for swearing, but sweet baby Jesus, if I see this again, I'm going to scream. One of them are pharmacists recommending, my patients are coming in, they've had memory problems, and I'm recommending I take it. So this pharmacist is David, and he says to the camera, he's been a pharmacist for 44 years. My initial reaction is newbie, and the way his pharmacy is laid out, initially I thought from
So it's
the
in
layout,
a pharmacy setting.
the
visual,
settings in a pharmacy, has the drugs to be picked up, but it looks like in the pharmacy, you can just, anyone can go and randomly grab a bag of drugs. It's like, oh my God, I think maybe he needs something else. Anyways, but what really gets my Irish up, he's got this big display, and for a long time when I'd look at the ad, what is this? But my husband said, oh, that's a plastic brain, and he's got the different types of Prevagen right there. Anyways, that just really gets it. But then there's another pharmacist.
So just a quick question: is he a real pharmacist? Well,
he's got the white coat. He looks old.
Oh, so it's an old white man in a white coat.
Yes,
very typical of our population.
Worn down. I'm guessing.
Oh well, there you go. If he's burned out, then it's.
I just well, I won't go there. The other one, there's another male pharmacist who is also, he and his wife were just feeling like they weren't as sharp as possible. And again, I admit I'm a terrible person. When I look at this ad, all I can think of is, why don't you use a hair supplement? Your hair is just, why are you on camera like that? Anyways, or at least wash your hair. Anyways, but pharmacists promoting this. And they always say, especially the younger one, is, let's say, mid to late 40s. I did some research, and that's why I recommend it.
Phrase that pays.
Oh, fucking did research. Oh, please. Okay, so pharmacists. I hate seeing pharmacists advertise.
But so it's funny that they don't, because usually it's always doctors, right? The doctor recommends this.
Not for Prevagen. Not for Prevagen.
Yeah, part of their tagline is it's the #1 pharmacist recommended brain supplement.
And why is that? If you look at so they put that on the screen, and it looks at the bottom of the screen. It says, according to 2022, 2023 drug topic survey. So I looked at the survey, and the way the question, and it's an annual survey of pharmacists in the community setting as far as what products they recommend. So I actually looked at the question a few years ago, and it basically, which of the following brain health supplements do you recommend? So it listed 4 or 5 by brand name, and then there might have been a category of other where they could write it. Well, Prevagen's the most heavily advertised, so of course, because the other 3 or 4, I really didn't even recognize their name. It might have been Nariva. Yeah. If you see the product, if you're watching TV, if you have a pulse, everybody knows Prevagen. But that's why they say that. It's the way the question was asked. But I did want to just mention the third type of Prevagen ad. And this is where they show, and it's really interesting. I'm not a sociologist. There's actually this wonderful sociologic analytic review that was published dissecting these types of ads and why they include certain people versus another. What these show, and I'd say the vast majority are women that are in the ad, but they've got a couple of men. There's Greg, who's African American, who they try to show him making a jump shot. Mm-hmm. He's so heavy, at least at the time, although recent Greg ads, he's lost weight. There's somebody else, Robert, I think he's from Missouri. He's also overweight, and all I can think of is, and he's holding his granddaughter and tries not to forget, sorry, I don't mean to laugh, who she is. But when I look at it, it's like, why don't you exercise?
Well, he's playing basketball. That's good.
Well, although I'm not really certain the Greg ad, he actually made it, because the camera kind of cut away. And, I don't mean to criticize. Oh, I hope I don't get sued. Anyways, the 2 men that they have highlighted, what has struck me is that they're overweight. When you look at the women that they highlight, like there's a 70-year-old retired dental hygienist that I think she's someplace in California or Nevada. And she's got bluebirds that she can call and they'll come to her and all this different
She's Snow
thing.
White or Cinderella? Like, I don't understand.
No, I mean, you have to sit. Anyways, I mean, being in geriatrics, looking at these women, all I can think of is, dear sweet baby Jesus, please do not let these women trip because they're going to be nothing but hip fractures. They are so thin. It's like, please eat something that's probably going to help you. But this one review of these ads talked a lot about how they position people. For example, there's one woman who's wearing bright red. The ad projects her as being powerful, she's in control, she's a leader, and she's recognized to stay at the top of her game. She needs to be really sharp. Anyways, maybe she has a lot of money to spend. But these ads are really interesting to watch, and also how they've changed over time. And to be honest, I'm not certain I've actually answered the question, Tony. But yeah, I do feel pretty strong about Prevagen, and I it's just, and I believe the supplement is safe. It's just, I think as an older adult, looking at these ads, hearing some of the marketing, I guess it's possible to have a benefit, but there are better things people can spend their money on. But again, people are welcome to spend it however they want to.
Well, and it's interesting too. So I think we're the only, just for our listeners, the U.S. is one of only 2 countries that allow pharmaceutical ads. I think New Zealand is the other one. But let's say somebody passed a law saying this is harmful. We don't want direct-to-consumer advertising. Could there still be direct-to-consumer advertising of supplements?
Yes.
So there's no control on that.
Well, the Federal Trade Commission, I think, regulates the advertising. And I don't want to misspeak. I think they regulate the advertising, especially online. And that's actually how the government, if they've been able to stop a product, it's usually through they've made an inappropriate ad. FDA, and again, maybe I need a brain health supplement. I need to check my facts. Again, mandates that products are safe and what's on the label is appropriate. If it's a structure, most dietary supplements have on their label what's termed a structure function claim. Probably a lot of people heard at the end of last week, yogurt has got a new claim on it, and it's basically, there is some evidence adding, for example, yogurt to your diet, I want to say 3 times a week, reduces the risk of incident diabetes. It's not, it doesn't.
And they get to put that on their label?
Yes, my understanding. And there are other supplements, for example, I want to say oats, maybe bran. If you look at, and not all the supplements in that type of supplement, but some of them will say, when used in conjunction with a heart-healthy diet, this may reduce the risk of heart disease.
Whatever, yeah.
But there are at least 3 different types of claims. The typical dietary supplement, though, is a structure function claim, will help to maintain memory. You're not saying that it cures Alzheimer's.
Right.
So, but manufacturers are very careful as far as that it does meet that standard. With brain health supplements, there are a variety of ways that you can kind of imply it has a benefit, but it's like healthy, you're maintaining health. That's kind of the underlying point.
And it's that ambiguity that is the marketing, right? People, like we talked earlier about some of those memory tests. Other than certain presidential candidates misstating what's actually on the memory test, won't name names, but orange hair. So the only thing is that most people don't know what a memory test is. I think I really want to highlight something you said earlier, is that memory can come and go. Stress, lack of sleep. There's a million things. It's kind of, I say that you can have generalized anxiety disorder, which is a defined disorder with characteristics, and people can be anxious. That doesn't mean that you've got a disorder, right? So you could not remember things because of all those reasons, or you could actually have some kind of cognitive deficits and things, which again, these products really aren't there. So Tony and I were wondering, as young people, okay, Tony's half my age. So for people of different ages who I don't know, Tony, why don't you ask your question?
Yeah, so last week, that's kind of how this all came up, is I said, I feel like at 24 years old, I shouldn't be forgetting as many things as I am. So do you think that there's like any sort of benefit for people without cognitive impairment or younger people who like we could benefit from brain health supplements, or there's something I could do now to help, stop this path?
No. The most important thing, Tony, and Jeff just mentioned it, stress, especially in your age group. And I think if you look at like the Alzheimer's Association, major national organizations, if you want to reduce your risk of dementia, and I have to emphasize, I don't think I said this early on, like people in my family don't die of heart disease. They die of dementia. Mm-hmm. So every time I see a study that says, well, if you have, whatever the issue is, maybe a rash, that puts you at increased risk of dementia. It's like, okay, let me just check another box. But a few things. I think most importantly, many Americans know what they need to do for heart health. Heart health is brain health. Don't smoke, limit alcohol. Notice I didn't say stop drinking, but limit alcohol, eating a healthy diet, whatever that may be. And we're not talking about big changes. It's making slow changes over time. Control your hypertension. I had a student just recently, we did this major systematic review looking at does one category of blood pressure lowering drugs have a benefit over others in terms of reducing the risk of dementia, including Alzheimer's dementia, not just vascular dementia. Controlling your blood glucose, exercising. I'm more of an introvert by nature, and I don't like people as a general rule, but engaging with people. One of the reasons why I've always enjoyed, especially as I've gotten older, faculty member, I love working with students. They're young, they're impressionable. A lot of them are still happy and upbeat.
Until after your rotation.
Well, no, I mean early in September. It's always so much fun. They're happy and excited. But really being engaged with others. Don't be with people you don't like. But there are probably 8 to 10 strategies that we know probably slow the likelihood of at least of some age-related memory loss. And the other thing I just want to point, and again, I've kind of gone off topic, that we as pharmacists, it's really essential that we do. We talk about doing like the annual Medicare wellness visits with older adults once they're eligible for Medicare, making certain they're having at least a yearly medication checkup. And really looking for medications that are highly anticholinergic. There's a classic paper Shelley Gray from the University of Washington did maybe 10, 12 years ago, looking at anticholinergic, and she works out of the Puget Sound database. It's observational, but it's probably as close to a clinical trial as we'll ever see on this topic. But what she clearly showed, the more anticholinergic drug regimen people carried as they got older, they did have a much higher risk of incident dementia. And whenever this study has come out and she's republished other things, the chief of family medicine has asked me, well, my wife, who's also a physician, takes a Benadryl at bedtime to sleep, and should she stop? Well, I would just ask again, is it really needed? Are there other things that could be done? But as pharmacists, maybe looking at those drug regimens, it may be that you can't make recommendations because of the patient's conditions and drugs, but that would always be high on my list to try to limit any anticholinergic drugs because I think that is a major risk factor. Oh, did I answer your question? So somebody your age range, no.
You said no, yeah.
No. de-stressing, having friends who are not pharmacists. And can I tell one more anecdote?
Go ahead.
So not uncommonly, when I would have clerkship students, I would ask them Friday afternoon after we'd finished meeting what they were going to do Friday night. And invariably, people might be doing some studying, board prep, whatever. And I would be going to a concert with my husband. And it was like, I'm your grandmother's age, and I'm going to have a rocking time, and you're going to be, just cut loose for a little while. It's okay. You'll still pass the boards.
So it looks like I have some work to do, is what you're saying. No, thank you for the advice. You did answer my question. I think you gave us some things to work on, especially for myself. All right. Well, thank you for your advice. Thank you for your expertise.
And the stories.
And the stories.
We love the stories.
We love the stories. I think there's a lot that we all could learn from you. So thank you so much for being here today.
And thank you for laughing at my stories.
Absolutely. This is probably going to be the most popular podcast. So on that note, since you've probably found this podcast because you subscribe to all the updates on wherever you get podcasts, turning on those post notifications, maybe you found us and you can share us on our social media sites. That's at PharmD.PubHealth. That's pharm as in pharmacist at PHARMD Pub Health. We're on Instagram, LinkedIn, and all those places. So smash that subscribe button now. This content just keeps on coming on Spotify, Apple Podcasts, YouTube, Amazon Music, or wherever you listen to podcasts. Thanks so much.